morning. How are you?
I'm good. Good morning.
Good. I'm Isabel. I'm going to be your nurse today, okay?
Okay.
And what is your name, hon?
I'm Sherry Oglesby.
Sherry Oglesby. And I'm just going to check your bracelet, Sherry. And what's your date of birth?
9/25/69.
Great. And how would you like me to refer to you?
Just Sherry.
Sherry's okay?
Yes.
All right. Well, Sherry, I'm going to go wash my hands and gather some supplies. And I'm going to be right back so we can check your vitals and start your assessment, okay?
Okay.
All right. I'm going to walk out. Let me close your curtain. Wash my hands, which I've done in the previous video. Gather my supplies. And come right back. Hi, Sherry. I'm back.
Hello.
Okay, that was pretty quick, huh?
That was quick.
All right, Sherry. So I'm sure you've had your vitals checked before, you know, your blood pressure, your temperature, all that good stuff. So we're going to do that first, and then we'll just go on with the head-to-toe assessment, okay?
Okay.
All right, so I'll try to kind of give you an idea of what we're doing as we move along.
Okay.
So I would normally start with the blood pressure, which we would have had checked off already, as well as the pulse and the oxygen. So I'm going to go ahead and start with the temperature. All right, Sherry, so I'm going to go ahead and check your temperature. Remove the cover. And these ones are kind of neat, so should be pretty painless. Okay, 98.1. It's visible. Okay, and I'm going to pretend to check her pulse, well, and I'm really going to check her respirations. Sherry, I'm going to go ahead and check your pulse again, okay? So just kind of relax your arm. Ready? Okay, very good. Let me just go ahead and jot this down. So I recorded your blood pressure. Her respirations were at 16 breaths per minute, which is within range. Your temperature, your rate, and everything else. Okay, so what we're going to go ahead and do now, Sherry, is go ahead and start the assessment. And again, I'll try to kind of explain to you what we're doing as we move along. Okay, so I'm going to start at the top of your head, and we're just going to move down, ask you to move around and do a couple things for me, okay?
Okay.
All right, so I'm just starting with your head, and I'm checking her hair distribution, feeling for any masses, symmetry. Very good. I don't observe anything out of the ordinary. Sherry, I'm going to ask you to do a couple of weird things for me. Just make some faces, okay? Can you give me a big smile? And as she's doing that, I'm checking for symmetry. How about puffing your cheeks? Very nice. And then just a big frown. Very good, okay? And I'm also observing her ears, which line up properly. I'm going to go ahead and grab my pen light, and I'm going to look into your ears, okay?
Okay.
All right. So using my pen light, I'm going to shine the light into her ears, and I don't see any discharge or redness. Any problems with your ears lately?
No.
Okay, nice and clear. Very good. No extra wax or anything. I'm going to look at your eyes now, Sherry. I'm going to shine a light on your eyes. Very nice. And the other one. Very good. I'm going to ask you to look at my pen. Just try to follow it, okay? Very good. Excellent, okay? So for that, I would document Perla. Her pupils are equal, round, and reactive to light and accommodation. Okay, I don't see any discharge in your eyes or any redness or anything out of the ordinary. I'm also going to check your nares. If you would just look up so I can look at your nose. And both nares appear to be patent, nice and clear. Let me go ahead and have you push on one side and just kind of breathe. And then on the other one. Little stuffiness, maybe allergies or a cold. That's fine. That's okay.
That's cold.
Yeah. Let's go ahead and open up your mouth. Stick your tongue out for me, Sherry, and say ah. Okay. Membranes appear intact and properly moist. Very good. And since we're still up in the head area, I'm going to go ahead and check your hearing. Okay.
Okay.
So I'm going to whisper a word on each side, and I want you to, if you hear it, repeat it after me. Okay.
Okay. Car.
Very good.
Bike.
Excellent, very good. Since we're still working on the head, Sherry, let's go ahead and have you just do some movements to see your
Okay.
range of motion, okay?
Okay.
I want you to kind of turn to your side slowly. Very good. And then the opposite side. Don't do it too quick so you don't get dizzy. Okay? Looking up. Very good, and down. Any pain or trouble with that?
No.
Everything good? Okay. And I'm just going to palpate to feel your carotid pulse, okay?
Okay.
Nice and strong on that side. Very nice and strong on the other side. Excellent. Okay, so I'm going to eventually have you step off the bed and do some exercises, but before we do that, I'm going to try and do everything we can do in this area, okay? So I don't move you
Okay.
around too much.
Okay.
So the next thing I'm going to do, Sherry, is I'm going to listen to your lungs, okay? So I'm going to go ahead and use my stethoscope and put it against your skin. Every time that I move it around, what I'd like for you to do, if you could, is take a deep breath and just kind of release it, okay? And I'll just
Okay.
kind of remind you, I'll tell you again, okay? All right. Okay, go ahead. Very nice. Again. Okay, and I'm going to reach inside under your shirt.
Okay.
Okay. One more time. When you feel the stethoscope, okay?
Okay.
Very nice. Sure, I'm going to reach underneath your shirt if that's okay.
Okay.
All right? Okay. Thank you.
You're welcome.
Deep breath. Okay, and the other side. Very nice. Okay, and I'm going to look at your sides, okay?
Okay.
Deep breath. And again. Okay. Now the opposite side. Deep breath. One more time. Excellent. Okay. Now I'm going to listen to your back, but for this I'm going to go ahead and just have you step off the bed.
Okay.
That way we can start everything else that we need to do, okay?
Okay.
All right. So again, I'm going to get behind you and I'm going to lift your shirt if you don't mind. I'll start at the top as I want to hear the top, the middle, and the bottom of your lungs, okay?
Okay.
So again, when you feel my stethoscope, just deep breaths.
Okay.
Go ahead. Again. Okay, I'm going underneath. Thank you. One deep breath. And again. And one more time. And again. Okay. I didn't hear anything out of the ordinary. Your lungs sound clear. So now I'm going to go ahead and listen to your heart. And again, the
Okay.
same thing as I move along, I'm going to try and tell you where we're going and move my
Okay.
stethoscope around, okay?
Okay.
All right, so I'm going to start by listening to your aortic valve, okay? So I'm going
Okay.
to your second intercostal space on your right-hand side for your aortic. Okay. Then I'm moving across to the second intercostal space on your left for your pulmonic. And then down to the third intercostal space to your Erb's point. Now I'm going to go underneath your shirt, Sherry, to listen to your tricuspid and your mitral valve, okay?
Okay.
So I'm going down to your fourth intercostal space. And now to your mitral. Okay, very good. And again, nothing abnormal so far. Since we're already standing and we've done a little bit of range of motion on your head, we're going to continue to do that at the rest of your thorax, okay? But before I
Okay.
do that, I'm going to ask you to slightly bend down as if you were going to reach for your toes. If
Okay.
it hurts, don't go any further. And I'm just checking. Very nice. Thank you. Good range of motion there. You can stand up. And I was just checking the alignment of your spine, which looks to be appropriate. And I'm looking at your torso, and I can see that her AP to lateral is in proportion 1:2. And I'm going to ask you now to raise your arms to the sides, Sherry. Careful there.